Hi, my name is Diane Yunghans, and I am the director for Nemaha County Public Transit. We are in CTD 3 and provide 5311 services throughout the Northeast Kansas area. Our main hub is both Seneca and Sabetha, but we do also do Northeast Kansas non-emergency medical transportation. Some of the challenges that we faced during this last year with COVID had been just the lack of information. We weren't sure if we would have a supply shortage. We did have some difficulties in the very beginning getting gloves and masks, but have since moved on to our Victory system. This is a electronic static mister that we use in all our vans. It has a short time to where you can, within 10 minutes, have another rider on your bus. It gets under services. We've really liked this Victory. So that's one of the solutions that we have come battling impact services through COVID. Another consequence of COVID were ridership. A lot of the doctor's offices had moved for a while to tele appointments, and so our ridership did go down. We did have issues with some of our drivers, and myself included, getting COVID. And then what did that mean to our program? Do we shut down indefinitely? We weren't really sure what protocol because it hadn't been ever done before. Some of the steps or changes that we made were to limit the client exposure, so we didn't do share rides for a very long time. The other safety measures that we were doing were we were sanitizing after every client, and we are still doing that. We are still wearing all our masks, and we're asking all our riders to do the same. Some of the lessons that we've learned were to plan ahead. You never know what is going to happen, and so you always need to have that step B. One day we had, or I should say 1 week, we had a situation where we had 5 people out due to exposure. We were still able to operate this whole time without any closures, but it has been a challenge. Since then, we've gotten vaccines for the majority of our staff. It is not a requirement. We're just asking them to do it at this point, but this has helped with lessening the stress of, is the driver going to get exposed or not having this vaccine? So anything that we would do differently, I would say just to be adaptable and know that plans change, situations change. We had a plan at the beginning of the pandemic, but those plans have changed with the amount of services that we were still needing to provide with limited staffing at times because of exposure. But all in all, I think we've had a challenging year, but a learning year that we feel has made us a stronger agency.